Guru Nation, welcome back. I have Dominique Fuller, a member of Guru Nation. He's a very versatile person in this space, okay, in clinical research. He got started. He says, watching the video, he says, because of my videos, he got his first CRA job. Let's start with that, Dominique. First of all, thank you so much for coming on. We'll start with that because there's a lot of newbies watching and they're nervous. Okay, they're nervous. They're like, Dan, I had a question yesterday. I have an oncology CRA interview, but I'm nervous because I don't have any experience as an oncology CRA. And when I dug deeper, they're an oncology CRC for like 7 years. I'm like, what
Yeah,
are you nervous about? Like they know you're
yeah.
not a CRA. Like what are you nervous? Almost to the point where they don't want to do the interview.
Oh, Jesus.
I know.
Yeah.
What advice do you have for these kind of people?
Well, I'll start off by saying thank you very much for having me there.
Thank you, Dominique.
Extremely exciting being here. It's as though everything is coming full circle. Just having a chance to talk to Dan Farah. So, I'm a big fan. And
Thank you.
again, thank you for having me.
This is gonna be a
Um,
classic.
yeah, man. So for me personally, I actually graduated with like a finance degree from Morehouse College down here in Atlanta, Georgia. And when I graduated, it was around the time of the credit crisis. And so I got a couple of jobs in the banking industry. I've worked for Bank of America, SunTrust, GE Capital. I've been a credit analyst, underwriter, loan officer. So I've done a few things in the bank. Wasn't loving it. My career wasn't growing the way I wanted it to grow. My salary wasn't showing the numbers that I wanted to see. And I just really didn't see that ladder of advancement or the opportunities that are available to you in research. So I was talking to a good friend of mine that I went to Morehouse with, and just kind of telling him like, hey, this isn't what I thought it would be. It's not working out. And he was like, hey, well, we have a startup site here in Atlanta, Georgia. And, if you're interested, you can come and do a little, interning and work with us a little bit.
What a nice
So
friend. That's a nice friend right there, Dominique.
I, I had never heard of clinical research before that moment, right?
See,
Didn't
this
even know
is
what it
what I
was.
tell people. This is what I tell people about. If you're doing everyone around you in your sphere of influence a service by getting into this space and learning more about it, not to mention patients, the patient fallout in a positive way. But yeah, I just wanted to throw that in there. But yeah, go ahead, Dominique.
Yeah. So when I started working there, because it was a startup, similar to what I'm doing now with Complete Clinical, it was very unorthodox, I would say, right? There wasn't really much of a formal training. So a lot of my training was on the job training, shadowing, and just kind of learning on the job, learning by fire. So with that, he gave me your website as well, which was ClinOps.
Dang.
Is that it? What was it? ClinOps?
Clinicaltrialsguru.com.
Is that it? Or
Yeah,
there was another
that's
one?
my
Okay,
website.
Clinical Trials.
Yeah,
So yeah, so I
ClinOps.
went
I'm
to
not sure. I heard of ClinOps, but it's not ringing a bell like where it's but I know of that. Oh, there's a website like that too.
it was a ton of your videos there, right? Like
Yes.
Dancer.
This friend,
And
I'm liking this friend. Where is he?
yeah, he's here in Atlanta as well. Yeah, I told him I was doing the podcast today. He thought it was pretty awesome.
Awesome.
Yeah, so started looking at your videos, getting a better understanding of the research industry, getting a better understanding of what's expected at a RMV, SIV, PSV, COV. Your videos, you literally lay it out. So just taking in some of that information, and then we started to actually monitor, in a way, other sites here in Atlanta, where I was more so doing like in-house monitoring, where I would do like a pre-check before they would have an actual visit, right?
Right, right.
And so that's kind of how I got my monitoring experience. So I did that for a couple of years. They started to pay me. I left the banking industry, but it was very unstable, being that it was a startup situation. And I was just looking to get more formal education and looking to expand what it was that I had learned. So again, using my experience on the job, using my experience or my education from Dan Sarah, I started to interview for larger companies. I did 3 interviews and I landed a job with Cineos Health. which was a great experience. I worked there for about 4.5 years. During my tenure there, I became a certified CRA through the ACRP, and it was a much more formal type of training as well within Syneos. So that was my first big CRA gig. From there, I actually worked on Operation Warp Speed with Icon GPHS.
Wow.
I Yeah, that was cool. That was different. So we worked on the Novavax trial. I'm not sure if I'm even able to say all that, but
Yeah. No, everybody knows Novavax. I actually featured them on my stock series. It's actually one of the better performing stocks over the last 2 years for most of
yeah,
the biotech. That's an amazing company.
outside of Moderna, which I'm so upset I didn't invest in. I saw it at $70, and then it went up to like 470, and I was like, oh my god.
Wow. Wow. Yeah.
Yeah.
There's a lot of opportunities still in that space.
hmm so yeah, I worked at Operation Warp Speed. I did that for like 6 months. Being there was like a mega trial. We were enrolling 30,000 patients. It was a goal of 300 patients per site over 100 sites across America. It was
Wow.
just, it was huge,
How many
right?
sites did you have to monitor from that?
Two. I had one here in Atlanta and one in New York.
Okay. That's not that
Yeah,
bad, but because there's so many patients,
600 patients. Yeah, it
wow,
was a lot of
600
data.
patients for your sites?
My two sites, the goal was 300, and I had high enrollers. I had one here in Atlanta
Wow.
that's very popular. I won't say their name. And then I had another one that was in Rochester, New York, and they both killed their goal. I want to say they were over 300 by the time I left.
Were you guys doing
Um,
100% source data verification?
um, no, no, there weren't like a ton of data points, and a lot of it was source data review versus SDV.
Yep.
But you're still looking at it. But
That's
yeah,
harder. That's harder. Everybody
right,
says that's not, that's SDR is way harder than SDV. I mean, I always tell people like they ask why are CRAs paid so much when all you got to do is look at blood pressure if it matches source and EDC. I'm like, yeah, that's SDV. Any like high school, junior high can do that, but
right,
SDR, how it integrates with the protocol, GCP, site SOPs, all the little nuances. That's where you need the experience. It's not the SDV guys.
right,
They think it's
right, and
so easy being a CRA.
it's definitely not. It's definitely not. It's a lot of hours into being a CRA, right? So a lot of days I wake up, I get started at 8:30, and I'm not done until like 10 o'clock at night. And that's
Wow.
on a good day from the house. On the days when I'm traveling, I'm on the road. They can be even longer. Oftentimes I'm working until midnight. Not
Wow.
complaining, but yeah. Um, and then, as you climb the ranks of CRA, so I'm a senior CRA too now. And
Congrats. Congrats.
yeah, thank you. So I've kind of maxed out the CRA role at this point. There really isn't much more I can do as a CRA than being a senior CRA too. So my next
How long
role,
did it take you to be senior CRA from from when you got in to become a senior CRA?
maybe like 6 years. 6 years.
Okay. That's pretty
Yeah.
fast, man. I want to say that's on the like low end of what's normal for
hmm
senior CRA. That's good. Do you think the pandemic helped you out? Because it just
Absolutely.
created the opportunities.
Absolutely. So definitely the pandemic helped. Also, I think it's my hunger for extracurriculars within the field. So like I said, I became a certified CRA. I did that like in 2017, I like to say. So I've
Okay.
been certified for like 4 years at this point. Also, I usually compete in the pharma trials researcher of the year. Companies love that actually.
Wait, what do you do? Wait, say that again. Do you compete for
hmm
pharma?
Trials researcher of the year.
Wow. How do
Um,
you do that? How do you enter into this?
Everyone can. So a lot
Really?
of times, yeah. So a lot of times, like the major CRAs, they'll actually our CROs, they'll actually ask you to do it. And
Pharma
so
trials
researcher of the
research.
year.
Look, guys, you learn something new every day. This is my thing for the day. And this is amazing how I have not heard of this. Clinical researcher of the year, Pharma Times. Okay.
Pharma times.
Okay.
Okay. Yeah.
Wow.
So by doing that, that actually gives you a lot of visibility because every major CRO participates in that. And so even when I left Cineos for Icon GPHS, the lady who was running the trial, she actually was also a judge for
Ah.
the Researcher of the Year. So they usually every major CRO sends out a couple of representatives to judge. So it
Wait,
gives
so
you a lot of
you
visibility.
won this thing?
No, I made it through to the second round twice.
Okay, I was gonna
I've
say
yet to
because
make it
I
to the
should
third
have
round.
introduced you starting with that from the beginning. So there's judges. I mean, this is insane. This is brand new to me. But just the fact that you participate and get to know the judges,
Hmm.
that's you're saying that helped you like as far as networking.
Yeah, or even when I'm talking about it in the interview process, because I think that it often lets them know that hey, this guy is going above and beyond because you have to do that on the side of your role. Like they're not giving you time to work on that. So,
Hmm,
in my spare time, I'm doing research or I'm discussing research.
I
And
see.
the way it works is like round one is like a multiple choice questionnaire. So you do like multiple choice and you have to
Okay.
make like 80% or better to make it to the second round. Round two is you write, I think it's you respond to like three questions and you do it in essay form. And then round three is when you fly to, I believe it's RDU, the Raleigh Durham area. And you go there and you sit in front of a panel and you compete. You could do it in a team fashion or you could do it as an individual.
Wow.
Hmm.
Shit.
And so,
What kind of competition is it? Who can find more deviations fastest?
yeah, or who can explain like GCP requirements in simplest form and, things of that nature.
Wow. Open
Yeah.
for
What do you think
everybody,
about?
guys. Pharma Times Clinical Researcher of the Year. I'm looking at it right now. Open for entry.
Mhm.
It's open. You have to wow, so your employer is like very happy you did this and you they were
Absolutely. And if you
and
make it into the third round, like you get additional PTO, you might get a bonus. It
really
depends, but yeah, it looks really good for the CRO as well.
what a good business idea by Pharma Times. Salute
Hmm.
to you guys. Okay, wow, that's brand new. That's more for Guru Nation to learn too, because anybody, literally anyone can apply for this and be in the contest.
Yep, exactly. So yeah, I would say a combination of that, and like I said, just you don't need the ACRP, CCRA, or the SOCRA. You don't need either one of those to be a senior or to get roles in the industry. But it kind of gives you like that stamp of approval where, okay, this guy knows what's happening. And at this point, most of my interviews aren't really even interviews. They're more so conversations and in a way, me interviewing the company. So yeah, things have definitely changed these days.
Of course. I remember when you were talking about the Great Recession in '08, financial crisis, and I was a site owner then, and I remember that happened. We lost like 90% of our studies overnight, and the CRAs that worked for those studies instantly laid off.
Hmm.
And a few weeks later, they were asking me for recommendations on LinkedIn because they were trying to find new work, right? And there just wasn't the work. And we're seeing the complete opposite of that now. We're seeing companies can't hire enough, like fast enough.
Recruiters are so aggressive. Just by having a LinkedIn profile, like I get like 3 or 4 recruiters reaching out like on a weekly basis, and they're aggressive. Like, hey, you didn't respond. I'm like, oh my god, I didn't have time. I don't know you. like,
Yeah, I love
like,
those ones. Hey, it looks like my emails are going ignored. Let me email you again. It's like I'm not gonna reply. What makes you think I'm gonna reply again? I didn't reply the first time.
it's
Yeah, they
literally
are
spam.
aggressive.
like literally spam.
So what's next? I mean, 6 year you've been in this industry like 6 years, 6, 7 years.
Yeah, like 7, 8.
Okay,
Yeah,
7, 8. So what's next for
yeah,
you? Because you're becoming a generalist very quickly. So what's next? Like,
yeah.
I mean,
Um,
I know you little. So Dominique was part of our site owner academy back in the day. He's always been, thinking ahead, how planning for his future. But what's next? Like for you?
Honestly, there's a couple of ways that this thing could go for me. So I'm considering taking a contract role. That way, I'm more so paid hourly. I hear there's a lot more flexibility, a lot more work-life balance. So I'm considering that route. Another route that I'm considering is just kind of staying where I'm at and elevating to a CTM role. I believe that
Mm.
that is in my near future. I have great rapport with my sites, with my LM, with my lead CRA. And I think that those relationships and the fact that I'm very clear in my objectives are going to help me to make it to that CTM role sooner than later. And then the third route and the route that I'm most hopeful for, but it makes me the most nervous, would be the route of site ownership.
Why does it
Um,
make you most nervous?
well, as you stated, like I've done the Site Owner Academy before, which is great, by the way. It's a lot of helpful information in there. You really break down that process in a great way. From where to go get my GADUFA certification, like I would have had no idea. And then you talk to some people about a GADUFA, they don't know what that is, and you're like, yeah, I
Right.
got one. And or even how to get my CLIA waiver. You're directing us to that and things of that nature. So you were extremely helpful the first round, with my attempt, but it's like I put so much sweat equity into starting up the site the first time, and then it
Yeah.
kind of just fell apart, and largely because of the pandemic, and then largely because like everything that I was doing was relying on my PI at the time to help me through the process, and I never even gained access to her EMR.
She
And
didn't
it's
want to give you access, or what was the issue?
she was saying that originally it was just a lot of back and forth regarding that, and I don't know if I ever got a clear answer. She
Mm.
was saying at one moment that her site manager wanted to discuss it with me in more detail before I had access, and then in another breath she said that, oh, I just don't have the patience, when originally she was telling me she had like 4,000 patients, and she wanted to outsource us recruiting patients from other sites and things like that. And I'm like, that's not the business model. So and a lot
Mm.
of that came, I sunk like $1,800 into her site between computers. I bought her a new scale. I changed her storage closet into a IP closet. I put in like a electrical plug in there and a fridge in there. I bought a -20 freezer. And then I spent hours like clearing out her back of her office, where it was just like, I have pictures. It was just crazy. And then I cleared it out though, and it looked great. Back in it was pretty, right? But it took so many hours and so much time. And then at the end of that, just for, never received the first study, never received any sort of payment. And the investment that I made, it was just basically lost.
Is
Um,
the relationship still there, or have you guys
yeah,
moved on?
Yeah, it kind of just faded away with the pandemic, because it was a lot of, oh, we'll follow up on this date, we'll follow up, and then we'll sit down, we'll have lunch, we'll talk about things, but it never made any progress, and eventually we just kind of stopped reaching out to each other. So I don't think the relationship is dead per se. Um, it's just not thriving. Yeah,
Yeah, it's tough, to be the PI. I know what you're talking about. I'm actually in the middle of doing that right now with a PI. I'm in the process of cleaning out his attic, whereas I'm going to be working for the time being. And I just bought a -20. I got all his equipment calibrated, paid for all that. Um, but I've asked them like 4 times, if I'll get access to EMRs, and each time they said, yeah, no problem. So I think I'm okay there. But you never know until you actually get access. But even that, for the people watching, even if you did get access, all right, that's still just the beginning,
right,
because, well, okay, you got access, great. What's the process now? And at the place I'm starting, my new site here in Yuma, there's like 7 providers. So it's not just my PI, it's 7 providers working for him, but they're all independently billing for themselves too. So they pay him like a percentage for letting them use his MAs and all that, but it's like their own business within his business. That's the
right,
model. So let's say I get the EMR, I look it up, I find a patient, there's 7 providers. chances are it's not going to be one of his patients. So
Right.
now I got to go talk to the provider. There's always like little strategy nuances. People think it's so easy. Oh, you get access to EMR. Okay, you get patients rolling in. Not how it works.
Right.
Right. That's not, it's just the beginning. Even if I talk to one of the providers and they say, okay, I say, look, your patient that's coming in next week at this time, they potentially qualify. Can you ask them if they want to do the study? Well, now they're going to ask me about the studies. Now I got to educate them. And now I got to
Hmm.
remind them. And there's always little things people don't think about. There's, at the place I'm going to be working at, every provider has their own medical assistant. I think this is my strategy that I'm telling you guys live here on the channel. Every provider has their own MA. Those always just the same MA for that provider. So I think it's going to be easier for me when I identify a patient to find out who's the MA for that patient, because it's always going to be the same one, and talk to them and work out a deal with them. And then the providers, they're going to remind the provider, hey, this patient actually qualifies. I'll still probably have to educate the provider anyways, but all this to show you guys that it's tough. But once you
Yeah.
figure it out, Dominique, oh man, oh man, I'm telling
Yeah.
you, this is like, it snowballs. It snowballs into a really good profit if you do it right and you're able to do it consistently.
Yeah. And I even remember that from a lot of the other students from the class, like they were doing well. And so that's been a lot of the reason why I haven't given up, just knowing that I do have peers through the Guru Nation that actually are doing well. And so now it's just, that didn't work out for me. It was very discouraging just because of how much work and effort I put into it. But
Mhm.
it's just time to get back on the horse, and I'm going to try it again.
So you have three options, and you're young too. I mean, you're just getting started. So even if you pick one and it doesn't work, like, you're still early in your career where you can still do anything you want. You can name any job that you want, basically. I mean, even CTM at this point, there's so many studies out there. They'd love to
Mhm.
have you as a CTM. So yeah, I could see the predicament you're in because you're doing so well in your monitoring career. And we've had students in our program that have been CRAs while they've been site owners. And there comes a point in time where they got to choose one, because you
Right.
can't do both well for the long term, right? It's a short term thing. You can burn the candle on both ends, but eventually you got to pick one. And I
Right.
think you're gonna come to that realization at some point. I mean, you haven't really started the site yet. You're just exploring the different ways you could go about it.
Yeah. Yeah. So, it's been fun. It's been fun. It's been eye opening. I learned a lot. I've learned a lot through experience. I've learned a lot through you. So, I'll just keep plugging away at it. Um, like we're doing well. Like on social media, we have a strong IG page. We have a strong Facebook page.
You do.
The website looks decent.
I
So
gotta
we're doing
see
well.
what's the IG. Let's tell people right now.
Complete clinical research at complete clinical
Complete
research.
complete clinical
Research.
research. That's
Yeah.
Dominique's site. Ah, here we go. All right, I'm gonna follow. Yeah, I didn't
Awesome.
realize you had this one. Okay, good. So any more potential PIs for your site?
So I followed the strategy of reaching out on LinkedIn, and I had some response of two PIs that I want to follow up with. I just haven't as of yet. So two additional potential PIs, and this time I'm just gonna search until I find the right partner.
Yeah, you're in Atlanta, right? Like the heart of Atlanta.
Yeah, yeah, like 15 minutes north.
It's kind of becoming competitive for sites. I'm sure you're seeing that. Um,
Absolutely.
I wonder what, I'm not too familiar with Atlanta, but if you go like outside the city somewhere, like more
Hmm.
rural, I don't know. You might, that's generally seems to be the strategy. That's what we did in LA. We went to San Bernardino, which is like inland empire. and there wasn't as much competition. Um,
Okay.
and then here in Yuma, I'm pretty rural. Like there's no other sites other than me right now. So that might be something, but then you'll have to commute. You'll have to commute a
Mhm.
little further, like an hour out of town. And knowing Atlanta traffic, that's like 2 hours out of
Right.
town, more more likely than not. Yeah, a lot of opportunities though. I think there's a way to do it. But as of right now, you're still doing senior CRA, and that's the plan.
Yeah. Yeah. That's what's putting food on the table right now. So
Yeah.
that's the plan for now. But I'm stable enough to take that leap of faith. So eventually I do intend to go full in on the site ownership, if that's the route that I decide to take. But
I wonder
for the
if they
moment,
will, because they're so desperate right now for staff. I wonder if they would let you be like a part-time while you do
I've
this.
considered that. I've considered that. I know that as a contract CRA, they do offer that.
Yes.
So that's
Yes.
something I'm definitely keeping in mind, just to, keep some cash flow as, we're starting out, being that I don't expect to make money for at least 3 to 6 months. So at a minimum.
Yeah.
So,
More like 9 to 12.
okay.
More like nine to
Okay.
12. I mean, yeah, 3 months, you probably get your first study. But that's after you found your PI. Unless you want to go back to the PI that you had. Um, yeah, you're probably 3 months. Once you find your PI, you're 3 months out from getting a study. Once you get a study, you're like a month to 2 months from the SIV. So that's already 5 months. So let's call it six when you
Okay.
start seeing patients. And that's 3 months after that, you start getting paid. That's the way I've seen it. So just to help you on the cash flow, but you got options, man. I think
Yeah.
you're in a great place. And I think a lot of people are going to be looking up to you because we know they don't really talk about it, but there's a lot of CRAs that want to open their own sites too. And,
Absolutely.
they're going to be, and they have done in the past. I mean, you've seen it from the Site Owner Academy, people
Yeah.
who have moved on, and one guy already sold his clinic and is going to another market to do it.
Really.
Yeah, I got to interview him. He's I don't know. We got to get. I'm not gonna call him out on the show, but he knows who he is. So we got to get
Is it
you
my
on.
guy in Texas?
Yeah.
Okay. I already know. Okay.
Yep.
That's
Yep.
cool. I didn't know that. That's really cool.
Yeah. There was some. It wasn't like a true sale. Like it was not something that he necessarily wanted, but I think it happened, and then now he's moved on to another market, but doing very well. I think a lot of the sites, just like the CRAs that have been doing well, because of the pandemic, the sites too. It's honestly never been easier to get studies than it is right now.
I can believe that. I can believe that.
They even almost don't even care. Like some of these studies don't even care if the PI doesn't have experience, as long as he has patience or she
Hmm.
has patience and has a coordinator that knows what they're doing. Like that's enough. That's how I got my first two studies. The PI has zero experience, but they gave us the studies because I'm the coordinator.
Got it.
And that's something I'm gonna have to start learning how to do again is coordinating because I haven't actually done that for like 10 years.
Got it. Okay.
So that
Getting
that'll
back into
be
the flow of things. Do you
back
do
in the trenches. Back I'm gonna actually drive patients again because they have Uber here, but it takes so long. By the time the Uber comes, I can just do it myself.
got it. Yeah. Yeah, I hear that. Speaking of, so that was actually my route as well. So I actually went and got certified as a phlebotomist to be
Ah,
a
good.
study coordinator. Yeah, that was an interesting decision. That was an interesting decision. Like, so I've stuck quite a few people, and I got stuck like 50 times to go through the class, but it was cool. And so now I'm relatively confident that I could be my own coordinator. I want to get a little more experience through drawing blood through like the Red Cross,
Yeah.
but relatively confident that I could do it if
Oh, that's
necessary.
good, man. I used to do that too, but we have in the practice I'm in, there's plenty of MAs, so they've already said they can draw blood. Um, but yeah, I mean, I've done that in the past too. I think most of my time is going to be spent like coordinating the visits, making sure they're actually coming, picking patients up, getting dry ice, keeping the patients entertained, bringing them food. I don't know,
Got it.
putting them on
Regulatory.
podcasts. Yeah, regulatory. Yeah, we're using
Yeah.
we switched to Creo, so I have to set that all up now. eSource, eReg.
I'm
Um,
familiar with Creo.
yeah,
Yeah.
have you used it?
Yeah.
Oh, as a
One of my
CRA, you've
sites,
used it, right?
yeah, one of my sites uses Creo. A couple of my sites actually use Creo.
What do you
One
think as a
here in
CRA with Creo?
It's excellent. It's excellent because the visits are organized well and they usually flow like how you would expect paper source to flow. Um, I like it. And then it has a section where they upload the documents that like lab results or EKGs and they upload those and it works out well.
Yeah, yeah, that's what I like about it too. It gives you the option to like, okay, you can still have paper, just you can upload it, like a note to file. If you don't have time to log in, you just really quick jot something down, upload it to the system. Now it's part of the eSource too. So that's pretty cool
And it allows for
platform.
remote monitoring in today's time. So if absolutely necessary, I can log into Creo with their permission remotely. And, sponsors love that in today's time because everywhere that I monitor at, we always are looking for a contingency plan at this point. So if
Yeah.
there's another global shutdown,
Man,
what's
don't
your
scare
plan?
us, Dominic. Don't scare us.
Right? Right.
um, back to monitoring. What are you doing more remote monitoring or are you doing more just the traditional on-site?
I hate remote monitoring. So
Why?
I
Why?
do. It's so hard. It's so much harder. Right?
People
It's
don't
so easy
understand
just
that.
to
People don't understand why. Because like what is it that makes it harder?
it's a lot harder to do like a ISF review if I'm doing it remotely because you can click, but the computer's has to think from page to page. Whereas if you're doing paper, you're just flipping, or with source and them uploading redacted source and things of that nature. If you're doing it remotely, you may be missing something, and you have to contact the site to upload, and they'll upload it when they're ready.
Yeah.
And so it's just a lot more difficult and time consuming to do remote monitoring. And then as a monitor, typically if you're working for like one of these major CROs, they don't even give you a full day credit for doing remote monitoring.
Really?
Yeah, you get a full day if you're on site, you get half a day if you're doing it remotely.
That's nonsense.
So
What?
yeah, so if you're doing like 8 to 10 days on site, then and they're all remote, then that's really more so like 16 to 20. And a lot of times that means at least 16 or so reports. And so
So you're
it's a
getting
lot
half
more.
the credit for like double the work basically, just because
Yeah.
you don't have to travel.
Yeah. Which is cool, right? You get more time at home, right?
What would you rather have? Less travel or zero travel but harder monitoring, or traveling but easier monitoring and full day credit?
I would rather travel and get my credit. I would rather travel.
Yeah.
I love the points, love the programs, right? Like that's like the fringe benefit of being a monitor, right? So, free vacation whenever you get time to do it. But, so I love that. And then I love the fact that, it is again less work.
Yeah.
So when you're traveling, you're not necessarily expected to be typing and whatnot. So
Right.
yeah.
Are your studies winding down right now, or are you about to be put on new studies, or what are you currently doing?
It seems like study startup never ends anymore, right? Because we're constantly adding on new sites to every study that I'm on. And so like I have one study where we were expecting the enrollment to close in Q4. But here it is, we're in Q4 and we're actually adding on additional sites. So we're still doing PSVs, we're still doing SIVs, and we're adding on these additional sites and we're pushing back our end of enrollment based on the fact that we haven't met our goal yet. So it seems like that's happening a great deal. And I work a lot in rare diseases. So it seems like that just happens a great deal for me where study startup just continues to go on forever.
Let's pretend that you never wanted to start a site. Because some people out there watching, they have no interest in that, but they're interested in your career. That's why I say Dominic's the best of both the worlds, guys. He's versatile. He can go either way. let's say you never want to be a site owner. So from where you are right now, senior CRA, how easy would it be for you to be a CTM within the next 12 months?
It's going to happen.
Like no
So
problem.
no problem. It's going to happen. Like that is going to happen. Yeah.
And so
It'll be
how
that easy.
and this is what people I think don't understand because they're afraid. So your early story of how you got started, where your friend brought you in and it was somewhat chaotic, baptism by fire. I got an email from a coordinator the other day, brand new coordinator, working at a site. She's asking if she should leave. She's like, should I bail? This site is so disorganized. They don't have any onboarding. And I'm like, what do you expect? You're not going to work for UCLA. You're going to work for like some guy or gal who owns a site and it's like their fifth priority. So
Right.
I said, instead of bailing, why don't you take the initiative and create what you want to see? Like, they're
Right.
not going to stop you if they don't have anything going on. They're not going to tell you, oh, no, you can't do that. You're complaining that nobody tells you what to do. So do something, make it happen. Yeah, you're going to have to learn more, but who cares if you don't like that company? So what? Use it as your springboard to go on to the next, because like you see from Dominic, it happens fast. He could be a CTM, no problem right now, only 8 years later.
And that's 8 years from the start. But again, I started with Cineos in 16, and I didn't start monitoring even within the startup company until 14. So yeah, that's like what, 7 years, and then 6 years with major CROs. So
Yeah.
and it seems like a blink of an eye. It's hard to believe that so much time has passed so quickly.
Yep. Yeah, I think for you, because that you're an entrepreneur, like I think side ownership should be intriguing. I think I I don't know. Maybe I would do CTM first to see how you like that. Develop relationships with doctors, but don't feel rushed. You're in the perfect situation because you're not stressed out for over money, right? Like you don't need your site to work right away. So I
Right.
think if you treat your site as a long-term goal and just develop relationships with doctors, I think you can do both until you figure out where you're going to commit the rest of your time.
That's a
That's what
great
I would
idea.
do. That's what I would do because CTM seems like you you want to do that. So try it out for a year. Who
Yeah.
knows? Who knows?
Yeah. I just because I have to reduce the travel somehow. Like I have a 22-month-old and I have a 5-month-old at
Congrats.
this point. Thank
Congrats.
you.
Congrats.
Thank you. And it's really them that's kind of driving me to look for other avenues to make money, because CRAing is cool, but we're on the road a lot. And I would much rather have a little more time at home. But it's not worth it to do those remote monitoring visits. So
Not if you're getting half credit. That's the second new thing I learned today because I've never
yeah.
worked for a major CRO. I do some contracting CRA here, but it's starting to wind down. Thank God, because of my
Yeah.
site. It's the same advice I give you. Do contract CRA while you're doing the site. But I'm glad that contract CRA is winding down because the site's going to take like more than my full time. But how do you do, like, what advice do you have for the other people who are considering monitoring, but they have kids, young kids? Like, you obviously need a support system. You have your wife. I'm assuming she's handles the kids while you're out. How does that work for you guys? Like from a
That's
practical
really
aspect.
that's really all I have is she's at home now. So she's full time with the kids. I help out when I'm home. Obviously, I'm not, just I'm not completely out the picture when it comes to childcare, but she does a lot of that. And I go in, I do the monitoring, it's the best I got at the moment. I'm still trying to figure it out, but it's the
You
best I
know,
really have.
I think and I'm assuming you're talking to a line manager about all of this. Like the big CROs have been doing a good job of trying to keep their existing employees happy, like retain them. So they don't, last thing they would want is to lose you to a competitor because they're more amicable to your career. Your life changes, that everybody, like, you get family, you start having kids, your goals become different, like your priorities shift. So I'm sure
Right.
the line managers are trained in this stuff. I'm assuming they're trained in kind of mentoring you on your career to stay within the company. But this is another example why we always need fresh blood in the industry, because
Right.
when you go move on to CTM, who's going to replace your productivity of like 600 visits that you've monitored,
Right.
or 600 patients you've monitored? God knows how many visits that was.
Right.
Um, Somebody's got to come in. So this industry is constantly, as people like Dominic evolve, transition, become more in like the leadership role, we need new people to join. So, it's never too late to get in.
Yeah, and turnover everywhere in this industry is just so high right now. It's a constant talking point for us where my sites, their coordinators are churning like crazy. Within the CROs, I know the monitors are churning like crazy. So it's a great opportunity right now for, if you don't have experience or if you're not within the industry, to get involved.
Yeah.
I often have my site coordinators ask me that I can become a monitor. I just tell them just apply and keep applying. It's a numbers game, right?
Is
Like,
that really your advice? Just apply? Because that's what I tell people
yeah,
too. And they think I'm
yeah.
giving them cold shoulder.
No, just apply. Like, and if you don't get it that time, apply again. Like, keep applying. Somebody's gonna
They
want
think
you.
it's
Like,
like a complicated formula, like theory of relativity, like, okay, this, you got to do this with this square root of that. That's not how it works, guys. This is not a
it's not.
formula. It's you. You are the formula. What's in your head is the formula. And you just got to articulate that through your resume first, through your LinkedIn profile, and then verbally when they interview you.
Yep. Like I said, from the startup into my first major company, it was just 3 interviews in. Just 3 interviews in. So I interviewed with 3 companies, landed the third. And like I said, like I was honest. I told them where I got my experience from and how my experience came into play. And I literally, only time I had to do this was the first job that I landed. And I literally had to do like a mock monitoring visit on paper. I don't know if you've ever experienced that, but
Yeah, we
like,
do in the CRA Academy all the time.
okay. So yeah, like they sent this sheet of paper out and like, okay, well, correct what's wrong. And so they had me like catching small issues that were in the example that they were giving. And I was like, okay, well, he clearly can do it. So bring him in. And it was cool. It was cool. It really worked out well.
Wow. Yeah, that's and now you've got options, which is what everybody I mean, that's what once you're in that position, you have the leverage, all the leverage is on your side. And right now, honestly, the way the industry is, if you're an employee or a site owner, all the leverage is in your favor. It's
Right.
all of it. There's a shortage of sites, coordinators. There's a labor shortage in our industry too, just like in the other industries. So it's never been a better time, guys. Just apply, stop being afraid, and apply.
Mm-hmm.
Reach out to
Mm-hmm.
Dominique on LinkedIn. Or do you want people to reach out to you?
Please, LinkedIn,
LinkedIn underneath the
IG.
video, guys.
Yep, IG. However you want to do it. Website, just however you want to reach out. We'll love it. Any tips or any help that you may want to offer to me in the site ownership path, like, I'm there for it. Last time you and I had a discussion and you guys reached out to your network, I had like 150 coordinators apply to the role. It was
Seriously?
amazing. Did
Wow.
I not tell you that? It was crazy. I had put the job on Indeed and ZipRecruiter, and
Yeah.
then I told you and Chris about it, and then it just went nuts. It was actually so many applications. I didn't even get an opportunity to look at them all. And so,
Wow.
and that was right around the time the site started to crumble. So I ended up pulling the role down. But I was amazed at how many applications I actually received.
That amazes me. I didn't know. We got the lighter fluid, Dominique. We could
Yeah.
spread. Let's do it. We probably could do better now. Now we have a CRC Academy. That's a new
Really.
thing. Since you asked us this, I think it was like 2 years ago, right?
Hmm.
We have a CRC Academy now. It's been around for just about 2 years. So now
Oh,
that's mature. we're pumping out coordinators. The other day, a site at one of our clients in North Carolina asked for coordinators. We had 3 of them that they got hired in Charlotte.
Wow.
Yeah.
Wow. You're the man, Dan.
I didn't
Like,
know that.
honestly.
No, that's Monica, Chris. Like, I might be the face of it, but they're the ones putting in the work for this stuff. And like, they get all the credit from me because like I get involved if there's issues, but yeah, they're like the day to day. That's what they're doing. They're dealing with clients, students. I do a little more on the CRA side for the internship, but yeah, it's a team effort, man. It's not, there's no way, especially now with the site that I'm starting. We're gonna
I
need
can
more.
imagine.
We're short staffed. Everybody's short staffed.
Yeah.
What can you do? So that's awesome. Any last advice for Guru Nation? Um, they all have your LinkedIn. They have your IG. What anything else? Maybe there's somebody just like you, Dominic, from 8 years ago. Thinking about okay, well, where do I go? They get. I get emails. People are frustrated, like they can't get in somehow.
Be honest, be confident. Confidence is key. Be confident, know what you know and speak to it. And control your interviews with that. Just speak to what it is that you do know and expand on it. And if they give you a window, make it a door, and just like if you ask me about SAEs, I'm going to list out every single thing I know about SAEs. And I'm going to keep talking and I'm not going to stop talking until you make me stop talking.
Until they tell you to
Um,
stop. Yeah.
yeah. And so you can kind of like put the ball in your court that way. If you ask me about an experience, a common question is always a bad experience that you had with either a CRC or a PI. Think about the worst situation that you had with a PI or a CRC, or even if it was in the reverse, or they just want to see that you're able to overcome objectives or overcome adversity and that you can keep a cool head and you can work well with others. Prove that and speak to that and expand on that. And that's all I ask.
That's perfect. That's all we need right now. This what we could go for like 2 more hours if we wanted to. But I know you got to go, Dominique. But thank you so much for coming on. Everybody go to the LinkedIn, go to Dominique's LinkedIn, follow him right here. If you're in the Atlanta area, get to know him especially. And maybe you're a physician watching randomly and you're thinking of starting a site. Well, Dominique, he's been doing this already. So reach out to him. He's obviously experienced, knows what he's talking about. And thank you guys so much. Thank you, Dominique, for coming on. And thank you, everyone, for watching and listening. And we'll catch y'all later.
Thanks, Dan.